Hi, Dr. Crump from Crump Chiropractic. I'm just explaining how we use this device. This is it's quite a hard foam roll, and it's specifically designed to recurve a neck back into the normal curve. So we'll commonly now have people coming to see us, and they'll be coming in with a very particularly, say for example, a very stiff neck or trapped nerves down the arm. And if you look at their posture, rather than being like this, it's becoming normal for them to be like this. We actually put them flat to a wall, their head back, and they can't do it for more than 10-15 seconds. It's too painful. So we do need to come back this way. If our whole head's leaning forwards, it's like a building leaning forwards. It's causing tremendous pressure on the rest of the spine. So initially somebody would go through a course of care and would gently free the neck up and get pressure off and make it more flexible. In the second part of care, if they're happy to continue, we use these wedges. They come in three different sizes. So large, medium, small, depending on the height of the person. And if I can just demonstrate, so this would be like in the second stage of care, we would then use it on an exercise mat on the floor. I'm going to use my table here. We put it low in the neck with the knees bent because there's more flexibility in the spine. And then we're literally just lying over this. And we start with only 2 minutes a day for a week, 3 minutes next week, and we're slowly increasing to 10 minutes for a few months. And we're training the neck to come back into a normal curve. And then we're basically restoring the posture back into the upright where it should be, in a natural curve for your neck. And that saves it going into early arthritis. So that's just explaining to you about how these neck devices work. Thank you for watching.